Hi and welcome to all the Neetpg aspirants who are going to prepare for their upcoming exams. So today's topic in our one clinical sign a day, we are going to discuss about peripheral signs of aortic regurgitation. So this topic is very important in concern with your final year practicals. And it is also very important for Neetpg entrance as well as Neet SS entrance. So we total have 16 signs. Here we have 15 sign and the other sign is Locomotor Bricalis. So we are going to discuss these signs based on this schematic diagram which I have made. And first we are going to discuss two signs which are not named after a doctor, okay, a doctor or a scientist, which is Alfred de Musset sign and Lincoln sign. So Alfred de Musset was a poet. His brother noticed head bobbing of Alfred, and then later the doctor realized that on examination it was found that the head bobbing was corresponding to the pulse, and he was later diagnosed with aortic regurgitation. So this is Alfred de Musset sign, which is head bobbing with respect to your, which is corresponding to the pulsations of your peripheral arteries. The other point is Lincoln sign. So Lincoln sign is basically your popliteal pulsations. So earlier what happened is, this is the historical photo which was taken, and then there was a mystery that no one knew why the blurred photo was there in this blurred foot was there in the photograph. So later it was known that Lincoln had aortic regurgitation. So this was due to the popliteal pulsation, and hence it is known as Lincoln sign or big/blurred foot photograph sign. Okay. After these we have now the other 14 signs which we are going to discuss. Okay, so from head to toe we are going to discuss. So the first of all, the aortic regurgitation peripheral signs are seen due to the wide pulse pressure, and they are more common when the aortic root is involved as compared to the aortic valve. Okay, so now we have discussed the Alfred de Musset sign, which is the head bobbing with respect to the pulse. The next sign is lighthouse sign, which is blanching or flushing of the forehead. Okay. The next sign is your Landolfi sign. So Landolfi sign is basically the change in the size of pupil with respect to pulse. Other sign which is seen here is Muller's sign. So Muller's sign is uvula pulsations. The next sign is Corrigan sign, which is the prominent pulsations of carotid and the supraclavicular vessels. Next sign is Locomotor Bricalis. So Locomotor Bricalis is the visible prominent pulsations of the brachial artery. Now pulsations of the abdominal organs, they are named by some signs, and pulsations of liver is known as Rosenbach sign, and spleen pulsations are known as Gerhardt sign. Also now we have Waterhammer pulse. So Waterhammer pulse is basically the high volume collapsing pulse, and this is one of the topic which is you are asked to examine in your practicals. The next part is Quinky sign. So Quinky sign is basically digital capillary pulsation. So you will examine the nail bed, and you will see blanching and the pulsations of the nail bed, the capillaries in the nail bed. Okay. Next, as we have seen Lincoln sign already. So now related to the femoral arteries, we have three signs. So Traub sign is basically what we have is Traub sign is the pistol shot sound or the booming sound of the femoral arteries over the femoral arteries. Durozo sign is basically on auscultation. So in Durozo sign we compress the vessel proximally and distally. So on compression of proximal you will get a systolic murmur, and on compressing the distal segment you will get a diastolic murmur, and the murmur is also known as Durozo's murmur. The other sign is Hill sign. So in Hill sign what you do is we take the upper limb blood pressure and the lower limb blood pressure, and if the upper limb blood pressure and the lower limb blood pressure there is a difference of more than 20 milligram of mercury, so it is positive Hill sign. And it is also to note about the severity of AR. So if it is more than 20 it is mild, if it is more than 40 it is moderate, and if it is more than 60 mm of Hg then it is severe AR clinically. Now the last sign, the second last sign is your Sherman sign. So Sherman sign is basically the unexpectedly prominent dorsalis pedis artery in patients who are more than 75 years. Okay. Next and the last sign, which is not shown in the schematic diagram, is your Meany sign, and Meany sign is diastolic blood pressure drop of more than 15 mm with arm raised. So these were the 16 signs which we have discussed about in patients with aortic regurgitation. Okay, thank you.